ligament isn't necessarily examinable, but when I get to specific tests, the actual specific tests are what's examinable. So, if it is, say, a contact sport and they're wearing shoulder pads, don't take them off, keep them on. Because if there's any kind of shoulder injury, to get the shoulder pads off, you've got to move the shoulders around. So keep them on and either work underneath them, or if there is an injury, worst case scenario, you might have to actually just cut them off the person. So you want to come, starting from behind the person, start the medial border of the clavicle and just push on the clavicle, moving out laterally. When you get to the lateral side, pardon me, you can do something called the piano key sign. So it's literally like pushing down on a piano key and releasing. So when you're doing that, push down on the clavicle and release. You're looking for any differences between uninjured and injured side. When you push down, does it stay down or does it pop back out at you when you release? And that could just be the ligaments have been either strained or torn or something of that nature. So it's called the piano key sign because it's kind of like pressing down a piano key, but that specific test isn't on your handout, and that's just an FYI. So you'd start immediately making sure there's nothing wrong with the clavicle. Then when you get to the AC joint, make sure the piano key sign's all good. Then you're going to work your way next into the armpit, which I won't tickle you or anything, but what you're looking for in the armpit is potentially if there was a shoulder dislocation. If you have your hand in the axilla and the armpit, the head of the humerus, if it dislocated from the fossa, you might actually feel the rounded part of the humerus in the person's armpit. So if you're pressing, feeling around, you'll feel like the spherical head of the humerus. And if that's the case, you want to, if you feel okay, just feel the head of the humerus, you want to immediately check for blood flow distally, doing like a cap refill test, because if that humerus comes out, now it can potentially be squishing blood vessels, nerves, etc. to the lower limb. So check for blood flow to the distal part of the hand. And then what you want to do, this is going to be painful for the athlete, but you want to get the head of the humerus off of those blood vessels to prevent or to allow blood flow to the bottom of the hand or to the arm. So what you'd want to do is stick like a towel or sweatshirt, something underneath the humerus and the rib cage, and then you're going to take the forearm and bring it in towards the body. So if you can kind of visualize this, basically what I'm doing is kind of prying the head of the humerus off of all the blood vessels and nerves. So if someone's just dislocated their shoulder, by doing this, wedging it out, it's going to be pretty painful. And you can just strap, their forearm down to their trunk or something. But you want to preserve blood flow to the rest of the arm. And then if that's the case, get them for immediate attention. Just to clarify, shoulder dislocation. So dislocation, what I've just treated for there, is when the head of the humerus actually dislocates, it's out of the fossa. If it's a shoulder separation, it's where the clavicle and the acromion have come apart. So separation is clavicle, acromion, they've separated, or dislocation is actually when your arm, your humerus, comes out of its socket, so to speak. So you'll see some people, if they've had a shoulder separation, you might notice they have a big bump on the lateral side of their clavicle. That's just because, really, if it's separated, there's nothing you can do functionally. It's fine, you can get it put back down surgically, just so it looks nice cosmetically, but usually they just leave it. So, yeah.
So that's the same as our AC ligament separation?
Yeah, well, it is the ligaments that are holding the two bones together. So if they're gone or stretched. So that's that. Next, we'll move on to the functional muscle test. Oh, forgot one thing, sorry. In terms of the shoulder, it could be totally dislocated. You feel the head of the humerus in the armpit, or it could have subluxed. So if you think back to the patella, when the patella moves laterally and then pops back into place, so it looks totally fine. That same thing can happen with the head of the humerus. It can pop out and then pop back in again. So you can test that by doing an apprehension test. Same kind of thing as you did at the knee. So you're putting the arm through the same action or movement that would have caused the subluxation. So at the knee, we move the patella laterally. You try to move the patella laterally. That's where it would have moved when it subluxed. So at the shoulder, you're going to, so this is the first one on part 3 test, apprehension test, shoulder subluxation. You're going to abduct the arm up to 90 and then externally rotate. So if I can do this, and he's allowing me to do it, he's not apprehensive about the test, then he's A-okay. He most likely did not sublux his shoulder. If I go to try to do this and he freaks out, it's super painful, don't do it, then he potentially did sublux his shoulder. So apprehension, they're apprehensive about you actually performing the test. Abduction, external rotation. So, you can get the chair out of the way if you want to stand up. I'll go through the rest of the functional muscle test. So, a lot of muscles, antagonists, a lot of muscles do the same action. So, for all the tests, we've got the person in a specific position to try and isolate the specific muscle that we're testing. So, it's important that if you say up at 90 degrees or out behind you, that you actually, when you're doing the test, you put them in the exact position that we want them in. So for Pec Major, you're going to have the arms up 90 degrees, bent at 90 degrees, arms up like that. So if you think your pecs, like pec deck at the gym, this is basically what you're getting them to do. And you'd just be looking for strength, one side versus the other, any kind of pain. Really, you're just talking with your athlete, and when they press against you, noticing if there's any differences from one side to the other. So with them in this position, I can either block my hands on his elbow, and he can adduct, bring his arms together, and I can push against. Now, if you're like me, your arms aren't very strong, you might feel like you might not be strong enough to do it that way. An alternative, put your hands on their shoulders, make sure their elbow is on your forearm, and they can just adduct that way. So either way, basically they're just pressing against you at the elbow joint, arms up at 90 degrees. Whether you have your hands on their shoulders or down at their elbow joint, up to you. The next one we have is the lats. So lats start like iliac crest, lower back, all the way up, inserting onto the top of the humerus. So basically this one, doing the front crawl, swimming, those are basically your lats, that kind of emotion. So to test them, you have, bring the one arm behind the back with the palm facing forward, and you want to hold on to the person so they don't push and fall down. And then you're going to just grab onto their hand like a handshake, and you're going to push my hand this way. And then they just push against each other. And that's literally it. And just make sure you're holding on to them so they don't push and fall over onto the ground. So that's the lats. Arm behind, palm up. You're just gripping like a handshake and resisting as they try and push that way towards you. and then you can do it for both sides. Rhomboids aren't examinable, so this is just kind of an FYI, but rhomboids are attaching from the medial border of the scapula to the spine. So basically, they're just holding onto the scapula, and you can test the rhomboids by same position, and then you just push straight out. So you just push straight out. And that would be testing for the rhomboids. But
what's the difference?
So lats, you push this way.
Oh, you push that.
And rhomboids, you're pushing it straight out. So they retract or hold the scapula onto your back. But that's an FYI. The next one we'll do is the deltoids. So deltoids, top of the shoulders, basically those nice kind of teardrop muscles. There's anterior, middle, and posterior deltoids. So we have 3 different tests to test each part of the deltoids. So to test the anterior fibers, we're going to have flexion, so arms up in flexion, and you're going to resist flexion from flexion. So you're going to block at the top of the biceps, and you're just going to basically lift your arm up. And that's for the anterior fibers. Make sure you're blocking on the bicep and not on the forearm, because now if we try and flex, really, you can see his biceps contracting now. So it's from flexion, resist flexion. So resisted flexion, from flexion, with the palm up. And that's anterior. Posterior, we're going to go directly behind, so just turn around. Arms are out behind, and again, blocking on top of the triceps. If I block on the lower arm, now he's working his triceps. So blocking on the triceps, and you're just extending your arm out behind you. So that's the posterior deltoid. And then to get the middle deltoid, have your arms up, up 90 degrees, and from about 45 to 90, so from here to here, you're going to resist as he lifts his arms up. So that's for the middle fibers. So 90 degrees from about 45 to 90. So you can have them here, resist, or up at 90 and resist, but just not down low or way up at your head or anything like that. So bent, or up here to here.
Can you have all the tests at 90 degrees? Like, can you be back here at 90 degrees? Does it matter?
Yeah, it doesn't really matter, but I just keep the arms straight just so there's no confusion. Yeah. And then flexion. So that's the deltoids, those 3. Then we've got the, so we just did the middle deltoid, and like I said, 45 to 90. Then we have the supraspinatus. So supraspinatus is supra above the spine of the scapula, so it kind of sits up here. And to test this one, because it also raises the arms, you're going to do, you've got to isolate the supraspinatus from the middle fibers of the deltoid. So that's why deltoid we did 45 to 90. Supraspinatus, get them to have their arms, and then it's down low from about 0 to 15 degrees, you're going to resist. So if you just block from about 0 to 15, with your arms out at the sides a little bit, and resist. So if it's straight back, it's posterior deltoid. If it's angled out a little bit to the side, then you've got the supraspinatus. All right? And supraspinatus up top, infraspinatus, teres minor below. So we're getting into the rotator cuff muscles here. So infraspinatus and teres minor are the external rotators. So this one's pretty easy. You just turn around. Arms are at 90 degrees by your side, and just think rotator cuff, what does it do? External rotators. You want to block external rotation. So I can just have my hands on their forearms and rotate your arms out. And that's it. Make sure their elbows are in nice and tight and you're not up here or anything kind of funky. Just elbows in by your sides. Externally rotating, teres minor, and infraspinatus. Next is the biceps. So 3 different bicep muscles we're going to cover. A little bit of a different position for each one. So biceps brachii. So the biceps brachii tendon running in that bicipital groove. You're basically just going to palm up and resist flexion. So basically just the gym like doing a biceps curl. Like that. The next one is the brachialis. So that one's going to be palm down, resisting flexion. And then brachioradialis. So this one goes right down, inserting onto your radius. So it's called the beer drinker's muscle. Thumb up. Think of just like lifting up a glass off the table. So you have your thumb up, and then if you have your arm down and just resist flexion. So you can see with that, if I put my hand right here, if he starts flexing, you'll notice the brachioradialis sticks out right at the top edge there. As it comes down and inserts into the radius. So this muscle right there. Biceps brachii, brachialis, palm down, and then thumb up, brachioradialis. So just think radius up, thumb up. For those 3. And I think we just have 2 left. So, triceps, easy. At the gym, you're doing like a tricep extension kickback. So if you just turn around. Similar to posterior deltoid, except for now I'm not blocking at the triceps. We're trying to engage the triceps. So I block underneath this forearm, and then you just kick back like you're at the gym. You've got a weight in your hand, engaging the triceps.
Then you just have your arm at your side. Does it have to be back there? Or
no, it doesn't matter. Like as long as you're getting that kickback, and that you're blocking at the forearm, that's kind of the major thing. And then the last one is the serratus anterior. So serratus anterior is antagonistic to the rhomboids. So rhomboids keep those scapula in close to your back. The serratus anterior allows protraction. And I might just get you guys to move just a little bit. I'm going to need that table, just like this much space. So for serratus anterior, what you'll do is have the person with their arms straight out in front, and they're just going to collapse onto a table. Make sure their arms don't bend, but they're straight out. And what you're looking for is at the back, so if you just arms straight out, collapse. It's about a 45-degree angle. I'm looking at his scapula, and I'm checking for any excessive scapular winging. So if he had a problem with his scapula, they do protract a bit when you're in that position, but if the serratus anterior was totally gone, you'd be like one scapula way out to the side. Literally, it looks like a wing. Just popping right out at you. You can get up. I think that's all of them. So Pec Major, pec deck, lats, pushing the hand across the back, deltoids. We've got anterior, posterior, middle, serratus anterior, dropping on the table, triceps, biceps. We've done all those.
Can you go over the 3 different biceps? So it's biceps brachii, brachialis.
Radialis, thumb up, biceps brachii, just like curls at the gym, and then brachialis is with the palm. Keep the thumb down at your side. So it's literally like you're lifting a glass off the table. And you should, if you do it on your partner, you can check. You'll see the little muscle just below the elbow joint. And sorry, any more questions about those?
Bicep brachii, you start from here or here?
But just grab the It's anywhere in this kind of.
Or anywhere.
Yeah. So the part 3 test, we've done the apprehension test for shoulder, so that's abduction and external rotation. There's 3 more. So Jurgensen test is if the biceps brachii tendon that runs through that bicipital groove, if it's subluxing, meaning it's just snapping back and forth over those tuberosities. So for the Jurgensen test, basically you're just doing the same thing as you would when you're palpating the bicipital groove. Just come up the biceps till you come to the top of the shoulder, find that groove, and literally you're just internally and externally rotating. And a positive test would be if you can feel that tendon kind of snapping back and forth, meaning it's subluxing. So if you can feel the tendon kind of popping back and forth. So that's the Jurgensen. Make sure they're passive and that you're doing the movement. Next is for supraspinatus, the drop arm test. So there's 2 variations of this. You can either put their arms out to the side. You can either get them to put their arms out to the side and slowly lower them down to their sides. And if there was a problem with the supraspinatus, when they try to lower their arms slowly, one arm would just collapse. Like they just don't have control to slowly bring it down. You just fall to the side, hence drop arm test. That's one variation. You can do another variation where the arms are out to the side and you just literally slap them. And if there's a problem with one or both of the supraspinatus, one arm will just drop. So for the exam, it's up to you. You can either say, if you pull this card or it's on your sheet, you can just arms out, slowly lower, or if you want, you can just slap the arms down. Either way, everyone does slap. It's more fun. And then the last one is the external and internal rotation for the rotator cuff. So essentially what we did for Terry's minor, just checking to see if the rotator cuff is functioning, the muscles of it. So block internal rotation, so just rotating this in, and then block external rotation, push out. So if someone had, say someone's torn their rotator cuff, like my dad tore his rotator cuff, and I think he can get to about here on one side, and the other side's normal. So you'd just be looking for any differences from one side to the other. Internal.
Is that permanent? Like you can't do it anymore?
Yeah, like you could apparently fit like a softball between like where it snapped off in his arm. It's pretty gross. So, yeah, like if you tear it and it's bad, well, if you're older too, right? There's not much you can do. But I think you can get to about here. Like you should watch people put their jackets on. It's amazing what the rotator cuff does. You can't move your arm. I'm sure if they're younger, they do surgeries to repair. But when you're like 60, 70, so yeah, that's it.